Hello everyone, just wanting to talk about atopy and some of the questions that we had. Hopefully this is a good way of answering all the questions. We had lots of questions. Somebody asked me about allergy vaccines being the gold standard. That's certainly my belief. I think that used well, that I would get 75% of dogs that benefit from being on a vaccine. I actually use the Heska blood test and skin test usually together to look and see what the positive results are and then use them to make up a vaccine. Obviously you need to control all the other little flare factors that might go on, and there may be times where things do deteriorate. You need to use some antibiotics, or you need to use some steroidals to try and bring the problem back under control. But I would certainly say that allergy specific immunotherapy is very important. Some people ask me if this was a dog that had been allergic for a long time, an older dog, would that benefit? And I suppose the longer that we leave this diagnosis, my feeling is that the older dogs don't do as well. So if you are considering this is a diagnosis that's made usually within the first 3 years of life. Rather than immediately put the dog onto steroids, let's try and be sure of our diagnosis and then use the blood test and the skin test to create a vaccine. If not, there is really no point in doing those blood tests and skin tests. We've got another question here about if immunotherapy and cyclosporin doesn't work and steroids don't work, what else can we do? And that case that I looked at in the webinar, Benji, the rescue dog, we ended up going through various different decisions and deciding that we would go with Mazivet, which is a tyrosine kinase inhibitor. It is expensive, there's no question about that, but in a dog that looked Cushingoid like that did, steroids were out, Atopica hadn't really helped it was probably too old for immunotherapy. So look out for Mazivet, which is a mazitinib, it's a tyrosine kinase inhibitor, and see how you get on with that one. Is there any EFAs in particular you would recommend? I think obviously you can either incorporate them in the diet, as with the skincare diet that we talked about, or you can give them separately, either in a tablet or in a liquid form. And my belief is that there's not been enough real research done to say that one is better than the other one. Efavet did seem to have more research done than most. I think that all of these drugs have somewhat of a benefit, a steroid sparing effect, but on their own are unlikely to be effective. And what is your normal steroid dose for the initial atopic patient? I think it does depend on how severe the dog is. I would certainly be happy to use 1 milligram per kilogram. If it wasn't as severe, I might go for 0.5 milligram per kilogram. Use daily, probably for about a week, and then start to reduce the dose to the lowest dose that keeps the problem under control. So hopefully that helps you with those atopic questions that came up, and we will be doing another blog tomorrow where we will talk about food allergy and some of the queries and questions you had. Thanks very much. Bye bye.